Good morning. Thank you for joining us on Center Stage, Nonprofits of Tucson. If you are always listening to us on the radio, I do want to remind you that you can listen to this anytime on any of the major podcast platforms. And we will be switching over to just podcast here pretty soon. So make sure you find that now. You can search it at Center Stage, Nonprofits of Tucson. Like I say, on any of the major platforms, you will be able to find that. You can also find us on social media at Center Stage Tucson. So today we have on two guests from The Haven, and I am so sorry I forgot to ask you to make sure I pronounce your names right, so I'm going to try. Amy Graves, the CEO, and then Amelia Hunkasari? Yeah?
Perfect.
Are we good? Okay. So the Communications and Development Director. So thank you both for being here. I really appreciate you being here today.
Thank you for having us.
Thank you.
So can I have you just start with a little bit of an introduction of what is The Haven and maybe a little bit of history?
Yeah, The Haven has been around for 55 years. We're going to be celebrating our 55th anniversary next year. We provide substance use treatment for women. We are one of the only facilities in Tucson that is specifically focused on women. And women can bring also their young children into treatment with them. And that is something very unique that we do. And we have been doing that since the very beginning. So we help women and the whole family to heal from substance use disorders and really rebuild the family connection again.
Wow, 55 years.
Yes, long time.
So I guess before we get into too much, I want to make sure we don't forget. So you had mentioned before we started the show that there is an opportunity because you're celebrating 55 years for people who have been connected in some way to The Haven to share stories. Can you tell us about that?
Yeah, we're very excited. So Haven turned 50 years during the pandemic, and we had plans to celebrate the 50th anniversary, but those did not happen because of the pandemic. So now we're hoping to turn 55th anniversary into a bigger celebration. And we're asking anybody who's listening to send us their stories, if they have been connected or touched by The Haven in any way. So if they're former members of ours, family members, former board members, volunteers, anybody at all who has been somehow impacted by The Haven. We'd love to hear your story and hear how you're connected to us.
And how can they send you the stories?
You can reach out to us through our website. We're located at thehaventucson.org, and there's a contact form and phone number, or on our social media as well. We're at The Haven Tucson on Facebook and Instagram. So you can find us anywhere you are and reach out to us and share your story with us, hopefully.
I love that you guys are doing that. It's a really cool thing to make it that far in a community. 55 years is not a short time period. That's a really long time. And to show the connection in the community for that long, and then to be able to hear about the impact. A lot of times, when you're making an impact, you only see a tiny little bit right there. And then it does take a lot of years, sometimes generations, to really see how much that effect has rippled throughout the community. So
that's so true. We were just recently in an event and somebody came to talk to us, and they had graduated from The Haven in 1990s, like in 1995. And they were saying that I'm a Havenette, I'm so proud that I went through the program and I'm doing so well, I'm a business owner. And it was just so wonderful to hear their story. And, so many years ago, and they were still like so connected to The Haven, even though they had been through the program in the 90s. So we love hearing stories like this.
Can you tell us a little bit more about the programs that you offer and, maybe some of the services that are provided to the individuals who have come through those programs?
Yes, we provide 24/7 residential treatment, as well as intensive outpatient programming, where women can either live in housing provided by The Haven for free, or they can stay in their own homes and come to us.
And so when someone is needing help in one of these, if they're needing treatment and they're wanting to receive services, what does that process what does that look like? How do they, I want to say apply. I don't know if you have an application process.
It's very similar to those of us that have a primary care doc. You just pick up the phone and you make a phone call, and you are either referred by yourself, or if somebody has a loved one they're concerned about, they can also reach out to us for information. It's a one phone number, 520-300-5243, and we have a whole team of people who would be ready and desiring to talk with whomever calls for help. And from there, just very similar to what you go to in your healthcare, your physical healthcare, a person goes through an assessment, and it's decided what level of care you need. Do you need to go to the emergency room, the urgent care, or a specialty? For us, it's do you need to have intensive outpatient programming, which is about 9 hours or more a week for up to 3 months? Or do you need something that's really more intensive, but not quite the hospital level or the detox level? And you can come and stay with us at our residential treatment facility and have everything provided for you while you are there, focusing specifically on your recovery.
Are there specific substances that you're seeing, a bigger problem with right now in Tucson?
Yes. Yeah, we've seen the opioid epidemic. I think everybody is aware of that, how serious the issue is, not just in Pima County, but Arizona, the whole nation. And I was just looking at the recent statistics from Pima County Health Department, and we saw 500 overdose deaths, and 309 of them were linked to fentanyl. So fentanyl is definitely now the number one substance of use. And we've seen, like, just within the Haven, I was checking the last 3 years, we've seen people who have fentanyl or opioid use disorder. That number has increased 83% just within the last 3 years. So it used to be more different substances, and now we're definitely seeing the opioids and fentanyl. That is the main reason that people are seeking treatment. Amy, you want to add anything?
Well, I was just thinking how I've been in the field for 30 years, and when I think back when I first entered into mental health and addictions treatment, it was the Reagan years, and Nancy Reagan's slogan was "Just say no." And a lot of the help that was available for people were through the 12-step programs, which still serve people today and serve them quite well from a peer standpoint. The field itself has changed, just like physical health medicine. There are evidence-based programs. There are medications that help people work through and with their substance use disorder now. There's a whole plethora of ways that people can choose to address their substance use disorder, their addiction. And so the field itself has changed dramatically.
And the substances as well, like you're mentioning that they're changing. I'm not super familiar with a lot of different drugs. I'm just going to throw that out there. Or, the differences between them. I'm not super familiar with it. But I have heard of fentanyl, and I have heard of the problems that it's causing and the deaths. And I've heard somewhat that, some of it, they're intentionally, that's what they want is the fentanyl. And that they're being made in other countries where they're not, that they're not what they expect, I guess, when they're getting these things. Are you seeing any, I guess I'm guessing you're going to see a whole lot of different things from a whole lot of different places, but is it something where people are kind of getting hooked on accident? Is that really what people are choosing right now, knowing the risk that's involved in fentanyl? Do you understand what I mean?
Yeah. I think I was just checking the Pima County Health Department numbers, and they were saying that a few years ago it used to be that a lot of drugs were laced with fentanyl, and that was the risk. Like, you thought you're doing something different, but it ended up having fentanyl, and that might cause an overdose. But now fentanyl is becoming the substance of use. So people are actually seeking out fentanyl, and not so much that it's laced in other things. And fentanyl it's very addictive. It's people have to use it in about 10 to 12 times a day. So even every hour or so. So it's you have to seek it out a lot, and people are kind of like using throughout the day, and it's just a different kind of substance, and it's highly, highly addictive and also very deadly.
And if someone has, like we mentioned, family members that they're worried about, what would you say to a family member about kind of helping someone to understand, and I know we've only got a couple minutes before the break, but to understand the need to get off of this and the seriousness of this specific drug?
Well, addiction treatment, while addiction treatment has changed, the disease itself has not. And it is very common for people to attempt to enter their own recovery, go into treatment, try 12-step, go into detox, a variety of things, and then relapse. So that is part of the disease. It's something that we help address at the Haven as part of a course of treatment, either at the residential or intensive outpatient program, so that women have the supports they need to focus on their recovery intensely.
Mm-hmm. Well, and I did want to ask about that. I think you had mentioned that typically the program would be a few months long. If there was need for longer treatment, does the plan change, or is it kind of dependent on what that individual needs?
It's always based on what the individual needs, and women are welcome to come back as often as they need to.
Thank you. We are going to go into the break in just a minute here. We have Amelia and Amy from the Haven. Thank you so much for being here and for sharing with us, and we'll hear lots more about what they're doing and how the Haven is helping women and their families in very difficult situations to be able to be set free from substance abuse. And it's a very exciting thing to hear about the 55 years that they've been here. And so if you have been impacted in some way, or you know someone who has, please do reach out to them. What is that? How do they reach out again to give you the stories?
So our website is thehaventucson.org, or you can also find us on Facebook or Instagram at The Haven Tucson. Those are probably the easiest ways.
Okay, and don't forget, make sure you find Center Stage Nonprofits of Tucson on any of the major podcast platforms, and you can also find Center Stage on Facebook and Instagram at Center Stage Tucson. We will be right back. We are back with Center Stage. We have today Amy Graves, the CEO, and Amelia Hunkasari, the Communications and Development Director at the Haven. If you missed the first segment, we were talking a little bit about who they are and what they do, and they are serving women and their families, women who are going through substance abuse treatment. And they have been in Tucson for 55 years. So I'm going to go ahead and keep saying that, because 55 years is a really long time. And it's a really cool thing that they have been able to impact now generations of people in Tucson. So we are going to go ahead and jump right back in. And I want to ask, can you tell us a little bit about the Native Ways program?
Yes, we have a Native Ways program that is specifically designed for Indigenous women. The program was created in 2005, and it incorporates a lot of Native traditions and healing and practices. And it's really a space where Indigenous women can feel whole and respected. And it's a fantastic part of our programming, and it actually benefits all our members, because there's aspects like drumming or different ceremonies where everybody can participate. And the drumming is really a centering, like it's a heartbeat of the Haven. Whenever the members are drumming and dancing, it feels like it's the heartbeat of the Haven, and it feels really, really cool to witness that.
That's really cool, the opportunity that's there, and kind of taking that that approach of the whole person and who they are. And there are also opportunities similarly for families. Can you talk about some of the opportunities for the whole family to kind of learn, after they have come and received some treatment, how to kind of move forward in the next steps?
Yeah. Recognize that lack of adequate childcare is a huge barrier for women for accessing substance use treatment. So that's why we allow women to bring their young children under the age of 4 to the Haven, and we also serve pregnant women. So in some cases, women go give birth, and then they come back to the Haven with their newborn. So at the moment, we have 2 newborns and 1 3 months old at our residential facility. And we provide the children everything they need: diapers, clothing, bassinets, formula, whatever is needed. And then we also have some programming for a little bit older kids. We have a program called Celebrating Families. It's a 16-week curriculum, and it's designed for the whole family, all the way from toddlers to grandparents. And it helps families to process the substance use disorder and understand how it has impacted their family. It's all about learning healthy living skills like boundaries and communications, even healthy food. Every meeting starts with a healthy family dinner, and after that the participants break into age-appropriate groups to discuss the specific topic. So we just launched that part of our programming last fall, and it's really wonderful that we're able to kind of invite the whole family in and help the whole family, even though we mainly focus on the women, but we want to help the whole family because we do recognize that substance use impacts the whole family.
Yeah, and being able to have the women come in and to receive the treatment, and then to have the whole family be part of something and kind of re-establishing some of those bonds that may have been broken. It's a really great way to help them to continue down the path that they're wanting to go. If someone is coming and they're receiving treatment, and then once they leave, they're needing help with kind of restarting their lives, are there opportunities where they can get a little bit of help and maybe some guidance on getting back out into the world in a healthy way?
Yeah. We're talking about how substance use disorders it's a cyclical disorder, cyclical disease. And it's not in a vacuum. It does affect the entire family. It does affect the entire community, as we can see when we're out for a walk or on a drive, just in our daily lives. We see people on the streets who are suffering dearly. This disorder involves the whole family. And women need a variety of things, just like you say, some wraparound services. Not only do they need talk therapy, as we often think about it, those evidence-based programs and modalities we were talking about earlier today, but medicine and social supports. And by social supports, we mean housing and supportive employment. So how do people get back on their feet if they've come to the Haven literally with just the clothes on their back? How do they go from there to being caring, competent, positively contributing people in our community? So how do we do that? So we partner with other providers and faith communities in our community. We ask the women themselves, what is it that's going to help you find the strength to continue on your path to recovery? Because when you leave here, it's not just one and done. It is a lifelong management of a disorder or a disease, just like diabetes, for example.
And we help women with a lot of things that we might take for granted if we have them, like just having an ID or driver's license, birth certificate, social security number. A lot of women have lost these items in active addiction. So we help them just to get those like very basic things set up so they can start looking for employment and housing and basic services.
Well, and I like that you're saying that you're working with other partnerships, in the community as well, because having, again, that area where you guys know what you're really good at and you're able to provide these services and to help women who are in this, in this moment of time. And then when there's someone else who's really good at helping in the next moment, to be able to give them those connections, and here's where you can go to get the next step, and here's where you can go to get help in this area. It's so much more powerful because together we can all make such a bigger impact than we can in just the one. I'm always a little bit, I don't know, I love to hear the partnerships and the relationships, because if one person tries to do everything, if one organization tries to cover everything, you can't be good at all of it. You have to be really good at what you're focusing on. And so to hear that you are focused here and that it's not just a one-time thing, that if someone were to relapse, they're welcome back in. Can you talk a little bit just about what that looks like? If someone does need to come back, and what do they do? Do they just call you and show up and you'll take them?
Yeah, it's sometimes because relationships are established between the women who come to us to heal and the staff that work with them over quite a few months. They might reach out to somebody they have a particular trust and affinity with. In the end, they go through admissions again, and that number is 520-300-5243. And again, a live human being will pick up that line, and we want you to come back if you need assistance.
Yes. Amy mentioned earlier, there's no shame or stigma if you need to come back. We are always happy to welcome people back. There's no judgment, but we're glad you're here again.
Yeah, making that decision to come back, and it's okay to say I've made a mistake, but the decision to say that I am getting back on the right path and this is what I want to do is a very brave step. And so definitely calling and getting back in there is a very good thing. Can you share with us a story of someone who has been impacted by the Haven?
Yeah, I was talking earlier about we serve pregnant women, and when the women go give birth, we always hope that they come back to us with the newborn baby. But sometimes that does not happen. Sometimes Department of Child Services gets involved, and the children might be placed into custody. And we recently had a woman whose child was taken away from the hospital after just a few days, and she came to the Haven alone. And our whole staff really jumped into action, and we were really advocating for her. We went to court with her. We helped her, provided her a breast pump and a way to store her milk, and allowed her to go visit the baby. And we were like really advocating for her and hoping that she gets reunited with the baby. And then after about a month, they got reunited, and then the baby returned to the Haven with the mom.
That's so awesome. And again, being that advocate for her in a time where she really needed it, and knowing that just because they need the help, that doesn't mean that they're not going to get a lot of strong advocates and strong help. And it's a very, very cool thing.
Yeah, we really do everything in our power, especially when it comes to families and keeping families together.
Yeah, that I've heard you say it a few times today, and being able to keep the family together, I think, is so important too for the moms that are struggling. Because if you're going through this and you have to do it away from your babies, and you're feeling that as well, it just adds another layer of difficulty to an already very difficult process. And staying together helps those relationships and the bonds to be as strong as they should be.
Exactly, because
Very
we know how pregnancy, like all the hormones. I have a new baby, so I'm getting emotional just talking about this, but we know how much pregnancy and being with your newborn, like it's so important for the baby and for the mom. Like it's the bond, secure attachment that you form right from the minute that the baby is born. And if the baby is taken away and the mother does not get to form that attachment, and the baby does not get that attachment, that really impacts them both negatively. So that's why we strongly advocate for the women and always want to keep families together.
Absolutely. What are some of the things that, if someone wanted to get involved in supporting, what are some of the ways that they could support what you guys are doing for women in our community?
Well, as Amelia said, we are celebrating our 55th anniversary at the Haven, and we would just love it if people would get in touch with us at thehaventucson.org and tell us what their interaction has been over the years. We've met some people who graduated from the program more than 3 decades ago. It's wonderful to hear what the common threads are over the decades at the Haven.
And in addition to that, we take donations. We have a small boutique on our facility where the women can go and get clothing. As Amy mentioned, some of the women come to the Haven with just the clothes that they're wearing. So we have a boutique, and people can bring new or gently used clothing donations to us, especially seasonal clothing in the summertime when the weather is getting hot. We're always looking for shorts and t-shirts and clothing like that. And then also any kind of hygiene products, because we provide the women everything that they might need. So any hygiene products are also more than welcome.
Well, thank you both for being here on the show. It has been really good to hear about what you're doing and to hear some of the ways that people can get involved. Can I have you please give us the phone number again if someone wanted to contact admissions to receive services?
Yes, thanks, Danielle. 520-300-5243.
And then can you give us the website again if someone wanted to support or to make a donation?
It is thehaventucson.org.
Thank you so much for being here and for sharing all of this with us. It is a very, very powerful thing that you guys are doing to help women, and especially to help families, the families of these women who are going through these difficult times. We also want to say thank you to our sponsor, Right Way Heating, Cooling, and Plumbing. And make sure that you find Center Stage Nonprofits of Tucson on any of the major podcast platforms.